News Now, Special Edition.
Good afternoon and thanks for joining us here at 4:30. I'm Vanessa Murphy. This is a special edition of 8 News Now we're calling VAX Facts for Kids. Now that children as young as 5 can get the COVID-19 vaccine, we want to help families sort through information. Right now, just the Pfizer vaccine has received FDA approval for kids ages 5 and up. Now joining us in the studio to answer questions, Dr. Rutu Ezuthachen, also known as Dr. E, board-certified pediatrician, and Joanne Rupert, Chief Administrative Nurse at the Southern Nevada Health District. We also have a group of parents joining us on Zoom here because this is a mix of vaccinated and unvaccinated individuals here. The hope is for this to be a judgment-free zone and to have a productive discussion. Now let's start with Dr. E. Can you tell me what you believe are the benefits and risks of the COVID-19 vaccine for children?
Yes, absolutely. So I think when we're talking about the benefits and the risks of the vaccine, we just need to understand that the landscape for COVID-19 has changed significantly in just a year and a half. When we first started having our lockdown in March 2020, that variant, that original COVID strain was not making children sick the same way. They were seeming to be relatively untouched, not getting hospitalized, not dying from it. However, this past summer, when the Delta variant started, we started seeing children get sick, and pediatricians really started listening and noticing. We saw a 5-fold increase in hospitalizations. We've started having children dying from COVID. We're seeing increases in multi-system inflammatory syndrome, which can last for months for some of these children in terms of side effects. So this vaccine now is effective against the Delta variant, and the benefit is it can prevent hospitalization, it can prevent death, it can prevent the multi-system inflammatory syndrome that children are experiencing. The risks are the same as any vaccine: redness, soreness in the arm, fever, chills, and that's really your body saying, hey, I'm making an immune response and this vaccine is working. The risk of something really serious like anaphylactic shock is the same with the COVID vaccine as it is with all the other vaccines that your children are taking.
Thank you so much. Now let's go to Brian Almero. Brian, you are a dad. You told me you and your wife are vaccinated, but you're on the fence about getting the vaccine for your child. Can you tell me why?
So, I mean, it really comes down to it is the side effects. Yeah, I mean, my wife has been vaccinated since, beginning of the year or middle of the year. And it's the main concern really is, I know she mentioned, is the usual soreness and the usual, the way adults have it is going to be the same as on the children. It comes down to it is really what more? Is that really all the side effects, or is it more to it? I mean, has it been really tested? I mean, that's really my concern. So it's kind of like we're in the fence. If we're going to do it right away, or is it better to wait?
Thank you so much. And Dr. E, are you seeing this, parents like Brian who are on the fence, and what would you say to them?
Yeah, definitely. I mean, it's very understandable to want to know as much as possible before administering this for your child. And I think what I would say is, in terms of the testing, this vaccine has had over 400 million doses in the country. And so it's one of the most studied vaccines we've ever had out there. So that the studies are robust. Lots of people have been getting it. They're tracking the safety of it, and it's showing to be more effective in younger kids, and they actually have less side effects than older kids and adults.
And for Joanne Rupert, can you talk about, are you seeing this at the health district, some parents like Brian being hesitant, and what would you say to them?
Well, certainly I can understand their concerns about vaccinating their children. This vaccine, has been rolled out. It started last July in 2020, but the research for the mRNA, the messenger RNA, has been going on since 1990, and now that we're in this pandemic, the urgency really forced the rapid development of the vaccine, and we were able to also receive the researchers were able to receive funding for it. So the government had put a lot of funding into getting this vaccine developed and then also tested.
Thank you so much. Now, up next, we'll hear from more parents, both for and against the COVID-19 vaccine for children. We'll be right back.